You should know that chest pain varies from a dull ache to tenderness to a sharp searing pain anywhere in the chest. Secondly, you should be aware of all such aggravating factors which makes chest pain worse, including swallowing, coughing, deep breathing, movement, cold weather, sexual intercourse, anxiety, and eating. In the next phase, you should be aware of all such factors that are helpful in relieving pain, which includes food, antacids, nitroglycerin, rest, and massage of the painful area. Now, there are some important questions that you need to ask your patient before making a diagnosis. You will ask the patient what symptoms they are experiencing, including heart palpitations, anxiety, depression, lightheadedness, numbness or tingling in their hands or around their mouth, fever, chills, sweating, coughing, coughing up blood or mucus, feeling short of breath and smoking, tenderness, trouble swallowing, nausea, vomiting, swelling or pain in the legs, changes in weight, and pregnancy. You will also ask the patient if they have ever had a stress test, usually an electrocardiogram or EKG, while exercising on a treadmill, or have been treated for heart trouble with medications or heart surgery. You will ask the patient if they or anyone in their family have had any of these conditions: lung disease, asthma, chest surgery or injury, cardiovascular disease, high blood pressure, diabetes, elevated levels of cholesterol or fat in the blood, angina, phlebitis, emotional problems, obesity, congestive heart failure, heart attack, smoking. You will ask the patient if they began feeling chest pain after chest injury or another specific event, or if the pain is frequently associated with eating, particular stressful events, or heavy exertion. You will ask the patient if they are taking any regular medications, including oral contraceptives, diuretics or water pills, digitalis, bronchodilators, nitroglycerin, tranquilizers, sedatives, antacids, or blood pressure medications such as beta blockers, calcium channel agents, and antiarrhythmics. Now that you know the symptoms of your patient, let's know how to examine the patient. Well, this physical examination includes temperature, weight, blood pressure, pulse, listening to their chest and heart with a stethoscope, examining their legs for tenderness, warmth, or swelling, and electrocardiogram. Now, what can cause chest pain and what is typical for each cause? Well, there are different causes of chest pain that you should be clear about. Now, if the patient shows symptoms like tenderness in the chest, often worsening with movement or deep breathing, and possibly resulting from injury or a bout of violent coughing, then this might give you an indication that the patient has chest wall ache. Well, chest wall ache is the pain in the chest. But if your patient has typical symptoms like tenderness over the fracture, often accompanied by the sound or sensation of grating and crackling, then this might be an indication to rib fracture, which is a crack in one of the ribs. And what if your patient is having chest or arm pain that worsens when moving, putting pressure on the neck? Then, these symptoms might be caused by neck pain, which is in fact pain in the neck that radiates to the chest. And if chest pain is accompanied by burning upper abdominal pain, worse when lying flat or bending, particularly soon after meals, relieved by antacids or sitting upright, then heartburn might be a reason to this. Well, this is characterized as also known as GERD or gastroesophageal reflux disease, the movement of stomach acid up into and through the stomach, which connect throat to stomach and can lead to ulcer. Now, if the patient has chest pain along with burning upper abdominal, pain that is worse when lying down, sometimes relieved by antacids and made worse by aspirin, or drugs such as ibuprofen, then this might give you an indication that patient has ulcer. Well, ulcer is defined as severe irritation of the stomach or intestinal lining. Now, if the patient shows symptoms like fever, right upper abdominal pain or pain in right shoulder, nausea, vomiting, chills, sometimes jaundice, dark urine, then this might give you an indication that patient has cholecystitis. Well, cholecystitis is characterized as gallstones. Now, if the patient shows symptoms like tenderness in the shoulder, ribs, or muscles, often in the lower chest, may result after prolonged coughing, then this might give you an indication that patient has arthritis or bursitis. Well, arthritis is defined as the inflammation of the joints. Now, if the patient shows symptoms like chest pain behind the breastbone, aggravated by exertion and relieved by rest, and pain may radiate to the left arm, then this might give you an indication that patient has angina pectoris. Well, angina pectoris is a state of sudden spasms of chest pain caused by lack of oxygen to the heart muscles. What if your patient is having severe, often crushing pain behind the breastbone, sometimes with sweating, nausea, or vomiting? Then these symptoms might be caused by heart attack, where a blockage in one of the arteries feeding the heart leading to death of part of the heart muscle. What if your patient is having attacks of angina that occur more frequently or become more severe over time? Then these symptoms might be caused by crescendo angina, which is actually a more severe form of angina pectoris. What if your patient is having fever, chills, shaking, coughing up blood or mucus, sharp chest pain? Then these symptoms might be caused by pneumonia, which is a lungs infection. Now, if your patient has sudden onset of breathing difficulties and sharp chest pain, then these symptoms might be caused by pneumothorax, which is a disease of collapsed lung, an accumulation of air between the lungs and chest wall. What if your patient has chest pain along with sudden onset of breathing difficulties, dull chest pain, sweating, lightheadedness, apprehension, coughing up blood, and has swelling or tenderness in the calves? Then these symptoms might be caused by pulmonary embolus, which is a state of a blood clot blocking the flow of blood to the lungs. What if your patient is having sharp pain anywhere in the chest, often aggravated by deep breathing, coughing, movement? Then these symptoms might be caused by pleuritis, which is inflammation of the outer layer of the lungs. Now, if the patient has pain over the heart or behind the breastbone, often aggravated by deep breathing, movement, coughing, then these symptoms might be caused by pericarditis, which is an inflammation of the sac surrounding the heart. What if your patient is having searing chest pain that can start between the shoulder blades and abdominal pain? Then these symptoms might be caused by dissecting thoracic aortic aneurysm, which is a tear of the aorta, the largest blood vessel in the body, which comes directly out of the heart. What if your patient is having changes in coughing patterns, coughing up blood, chest ache, more common in smokers? Then these symptoms might be caused by lung tumor, which is a cancer of the lung. What if your patient is having severe pain behind the breastbone that is often relieved by eating, difficulty swallowing? Then these symptoms might be caused by esophageal spasm, which is a contraction of the muscles in the esophagus. What if your patient is having sudden and severe pain behind the lower breastbone, vomiting, sweating, often a result of a neck wound? Then these symptoms might be caused by esophageal tear, which is a tearing of the muscles in the esophagus. What if your patient is having chronic pain behind the breastbone, food regurgitation, heartburn? Then these symptoms might be caused by esophageal stricture, which is a constriction of the esophagus, which connects the throat to the stomach that doesn't let food pass. And lastly, if the patient has feeling like food sticks in the throat or causes pain, weight loss, malnutrition, then this might be an indication that patient has esophageal cancer, which is defined as abnormal cell growth in the esophagus. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of chest pain. To watch more such videos, do visit the DDX section only on sqadia.com.